Dr. Joe Nyamtoon. Welcome back to the Aesthetic Show Live. Here we are on July 5th, 2018. The day is kind of winding down and people are filtering out of the rooms. God, what a great experiences. There are so many doctors here from so many specialties and also non-physicians that have a lot to do with the success of cosmetic surgery. So this is kind of probably going to be my most interesting interview today because it's a husband and wife team. And we could go on forever about that, but we have Dr. FatemaNawabi and Dr. AbdulandNawabi. Thank you guys for coming today. And now,
thank you for giving me a degree, by the way.
Oh yeah, I'm sorry, not a doctor, but that's okay.
I'll
You're
take
honorary, okay? But you make that doctor a
Yes.
good doctor. Now, last year I remember that you won the best aesthetic practice in the country at the aesthetic show. Is that
yes,
true?
Yes, we did.
Well, congratulations.
Thank you very much. Thank you. Really appreciate it.
So you don't just win that award without being really good at something. And so what I want to do here is first, I want you to just tell me a little bit about yourself, and then I'm going to ask you the same thing. And then I can't wait to ask about working husbands and wives, okay?
Well, thanks for having us. First of all, my name is FatemaNawabi, and I am the practice manager for Alamo Hills Advanced Aesthetics and Laser Center. I work alongside my husband, Dr. Nawabi.
In Simi Valley.
In Simi Valley, beautiful Simi Valley, California. Our practice has been around since 2008. I have been actually managing it since 2010. So I've been a manager for about 8 years. And I basically managed hiring, managing the staff, training, talking to the vendors, whatever services that need to come into the office. When it has to do anything with medical, lasers, I have Dr. Nawabi take care of that. Anything medical, but anything that has to do with management of the practice, I take care of that.
Very good. Now, Doc, tell us a little bit about your story, buddy.
You know, my name is Dr. Nawabi. I am from Afghanistan, and I came to the United States in 1986. I did my medical school in India. I was there for 8 years, and then I did my residency in San Antonio, Texas, and then I came to California. I started practicing medicine with a group of doctors, did family practice up to 2008. In 2008, I decided to start an aesthetic medical spa. And the reason was that the community needed, and also I wanted to have a future, because as you all know, that medicine is getting tougher and tougher for solo practitioners because of the insurances, a lot of other reasons that people know. So I needed to have another source of revenue, and moreover, the community needed us because everybody from Simi Valley, which is a small town of 124,000 people, they needed a proper aesthetic medical spa that they should go and trust, and that they will get the proper treatment and quality treatment.
And you know, it's kind of interesting when you look at meetings, and this is, like I said, a great one. You know, 20 years ago, you didn't see many family practice or primary care or internal medicine docs at cosmetic meetings. And now that's becoming a big part of what's going on. And I think the power of what is happening now in contemporary cosmetics is the multi-specialties that pull from things. For instance, who knows more about anti-aging? And boy, we have some special guest stars walking through here today. Who knows more about anti-aging and things like that? And that's a big part of your practice too, right?
Yes. So 6 years ago, I started another company, which is wellness and weight management, which is very successful. As we all know, that 70% of the United States is overweight, and more than 30% are morbidly obese. So a lot of diseases are connected to obesity. So I decided, rather than start giving medication for different diseases like diabetes, high blood pressure, high cholesterol, heart problem, I try to manage their weight. And if I cut their weight down, I'm sure a majority of their problem will be resolved without medication. So I have got a slogan for that: live long without medication.
It's a good one. And you know, I think it's interesting that, and I have a lot of friends that are primary care, family practice, internists that do various cosmetic things. And me being a surgeon, if my hands aren't bloody, I'm not producing. I'm not making any money. And you're kind of just the opposite. You use your head, and you do so much that is not a invasive situation.
Yeah, so I've got a really busy schedule. I get up 6 in the morning, work till 6 in the evening, and then go home. You know what I do at home? I'm a chef. I start cooking. Oh, yeah.
Wow. What an interesting
He's really
family
good.
dynamic. Okay, now, here's what I wanted to ask, okay? I've got a great wife. We've been married 20 years. I didn't get married till I was old. And we have a wonderful relationship. But she would beat my butt if we worked together. I mean, I can't even imagine, if she worked in the office, she'd be the staff's friend and I'd be the bad guy. And I have a lot of friends that have their wife or some family member working in the office. And I think that's a tremendously interesting dynamic. Now, let me ask you a couple questions. Do you guys drive to work together?
No.
No?
We don't drive together, and even in the office, majority of our patients and clients do not know that we're related.
Okay. And in the course of a day, do you see each other very much?
We do see each other. I call him by Dr. Nawabi, and he calls me by my first name. It's very professional in the office.
Nobody would ever catch you kissing or anything?
No. I hope not. I hope not.
Okay. All right.
My office door is always open, so.
Yeah, okay, I hear that. Now, do you, how does your, if you talk to some practice management experts, they're very much against that. And they think that that the staff is going to look at the wife differently and everything. How does that all work in your office? I bet you're their friend, huh?
In regards to
The staff, in the getting along, in the everyday. I mean, you've got to discipline people.
Yes.
You've got to fire people. You've got to hire people. I mean, is there ever a situation where you had somebody, man, that's my favorite employee, and she said, no, they got to go?
You know, the good thing with him is he lets me do my job. He lets me manage, and if it's something that he thinks that I could do better, or he'll suggest it, but he really leaves me alone. He trusts me in managing the practice, and at work we are, like I said, we're very professional, and even our staff know that, you know what, she's our manager, he's our medical director, so they know what to come to me for help, and they know what to go to him for, advice.
It is so important to understand between husband and wife that it is business and it's home. She knows what she's doing as far as management of the company is concerned, and I do not want to cross that. If somebody comes to me and say, I need to do this, I say, go to your manager. So I don't cross that line. If a patient comes to me, I say, go and talk to the manager. So we create an environment that everybody knows their rule, who is who. But overall, in our company, we try to say that nobody is the boss. This is a ship we run. A ship does not run without a proper crew.
Yeah.
If you do not have a good employer and employee, then the business will not be successful.
No,